Good morning, everyone. Thank you for taking the time out today to join the 5 ways to supercharge your wellbeing strategy. The last year, I'm going to avoid using the term unprecedented. I promised myself that I would never use that term again. But we face significant challenges, and it's our people that have got us through this period, in all honesty. Our people power our organisations, but well-being is what powers them. And well-being's never been hit so hard, quite simply. And that's why I guess you've joined this live session with myself and Laura Dallas as well. So within here, we're going to share 5 tips and 5 ways that you can supercharge your wellbeing strategy going forwards. So firstly, a huge welcome. My name's Harry Bliss. I'm the CEO and co-founder of Champion Health. I'm going to share a little bit about the why behind Champion Health. And at the end, I'm also going to share with you the really exciting new platform that's been labelled the Netflix of Wellbeing. And we're going to share a sneak peek, and that's just gone live now. So this is a live session, it's recorded. So if you do need to jump off at any point, or if you'd like to share it with your colleagues or with your network, then it will be uploaded to YouTube, and our wonderful marketing lead will share that with you following this session. Please also ask questions throughout using the chat function. So I think you'll all be familiar with Zoom, a bit too familiar with Zoom from the last year, probably. I definitely have that feeling sometimes. But use the chat function. We want to tailor this to you. That's the most important thing for us. We could just deliver an off-the-shelf live session that doesn't necessarily translate into action. That's not what we want to do at all. We want to make it really relevant, and the way that we can do that is by you engaging through the chat function. So you might just want to pop a little hello in first of all, but you also may want to start using it to ask questions throughout. We'll answer those questions at the end as well. So we've got a live Q&A that myself and Laura will be able to share our thoughts about things such as the future of workplace health going forwards. We're going to be sharing our secret sauce, and this is probably my favorite slide ever. Ricky, who's our creative director, put this together, and I'm absolutely in awe of it and him. But our secret sauce is created by a blend of health professionals ranging from GPs, academics, cognitive behavioural therapists, sleep professionals, physical activity experts, nutritionists. I could keep going on, but I've not got enough oxygen to be able to do that. But most importantly, it's also created by the likes of you, by leaders within organisations that want to put people first, but also by employees themselves. If we don't include the employees within this secret sauce, the secret sauce is going to taste horrible, quite simply, and it's not going to work. So we're going to share with you the secret sauce that we've come up with. But before we go on to that, the most important thing within Champion Health is the why, and the why as to why we do exist. So I founded Champion Health over 3 years ago, and if I'm being completely honest, we had a really strong team of academics, health professionals, a very strong wellbeing model, but we lacked experience in running and scaling a business from the operational side. So I approached a friend of mine. I coached his kids at cricket at the local cricket club. He was a director of a global wealth management company. He'd raised over £750,000 for charity. He was a father, he was a partner, and tragically 2.5 years ago, he ended up taking his own life due to workplace stress and pressures. So that's the fire in my belly, that's the fire in our team's belly, and we'll never forget that's at the forefront of what we do. It's just something as serious as this, but we also want to focus on the whole organisation to be able to support those individuals that are well and thriving to how they can thrive going forwards, but also those individuals that are struggling as well. So focusing on 100% of the workforce. So over the last year, we've been firefighting, and I say you've been firefighting as leaders within organisations. There have been so many fires where fires haven't been. You've been having to put them out and be as reactive as possible. No one could have prepared for this situation. But as we look into the future, this is where we can start planning in a proactive way as to how we can really support the well-being of the workforce going forwards. What I'd love is just within the next 15 or 20 seconds, just share what challenges within the chat function. It could either be to me personally, so you won't be identified, or it could be to all attendees, because I think you'll be surprised that a lot of people will be sharing the same challenges going forwards as well. So over the next 15 seconds, just share what challenges you think you might be facing over the next year. And again, we can then look to personalize this live session to you at the heart of it. So it may be, how do we generate engagement, for example? That is often a major challenge. It might be, where do we start? How do we generate the data to make those decisions? Some of those things we will definitely be able to answer going forwards. So thank you for your engagement initially as well, and please engage all the way through. So in terms of your speakers today, you're going to hear less of me, fortunately. So I'm going to mute myself shortly and pass over to the wonderful Laura Dallas. Laura is our wellbeing lead, and we're extremely fortunate to have someone like Laura that is extremely empathetic, first of all, understands the challenges that organisations face and employees face, but is also extremely knowledgeable within this space. I think the challenge for you is going to be, what do you take away from this? There's going to be a lot of information. All we would ask is, if you can take one thing away, then we've done our job, and we've achieved what we want to achieve following this. So you might want to get a pen and paper out, but like I said, there is a live recorded version of this. Sit back and enjoy. It's going to be around 20-25 minutes of Laura taking you through this. I'm going to take you through a sneak peek, and then we've got the live Q&A at the end. So I will see you shortly. I'm going to pass over to Laura now. Thank you very much for attending.
Perfect. Thank you so much, Harry. It's lovely to see you all. Thank you for joining. So I'm Laura, and I'm the Wellbeing Lead here at Champion Health. And I'm really excited to share today our 5 key principles, as Harry has mentioned, to help supercharge your wellbeing strategy. Now, before I get going, just a little bit about myself. So my background is in psychology, and I've worked in a variety of mental health services in the NHS, and also research roles in London before I came to Champion Health. And actually, thought I'd take the opportunity to mention that it's my work anniversary today. So it's been 1 year since I joined the team at Champion Health. So I started last year on the 23rd of March, which I'm sure many of you will now recognise as the very first day of the very first lockdown. So it's certainly been a journey over the last year. It's been quite a whirlwind, and I could never have expected the kind of people and the kind of organisations that I would have met along the way. Organisations that really care about their employees and really care about employee wellbeing. So in my role as Wellbeing Lead, I support our organisations to develop health and wellbeing strategies. And that's where this webinar has come about, because from my experience and also from my research, we've really got to understand what works and what doesn't when it comes to developing a wellbeing strategy. And those are the key 5 things that I'm going to share with you today. So I just want to reiterate before we get going what Harry said. I'm going to try and cram in quite a bit into the next 15 to 20 minutes. So don't worry if you don't take all of it on board. And actually, it might feel quite overwhelming to implement all the different information that I'm going to share with you. So what I'd really encourage you to do is to take one piece of information, one golden nugget that you'll be able to implement tomorrow into your strategy and implement it well, because that's what will really make a difference by starting small, focusing your resources and then building up from there. So I thought a good place to start would actually be to define what a wellbeing strategy is. So a wellbeing strategy can be defined as a clear framework that identifies those wants and needs of employees, and then really implements the initiatives that will make a real difference for your employees' lives. And the good thing about having a clear framework is that it means you can proactively manage the initiatives that are put in place. So it's not a document that's stagnant, that sits in the bottom of a drawer and isn't looked at anymore. It's actually a framework that's responsive and can evolve to your employees and your organisational needs, because I think we know from the last year that they have certainly changed quite a bit, in fact. And any strategy is data-driven. So it's not merely based just on your gut feel as a leader. And when you base the strategy on data, then you're really targeting those issues that matter. And it becomes more than just a tick box exercise. And actually, I will come on to talk about the data in a little bit more detail later on. So let's get going, won't keep you waiting any longer. The first way to supercharge your wellbeing strategy is through proactive and reactive initiatives. So what do I mean by these terms? Well, we'll start with the reactive initiatives that you can see at the bottom of this triangle. And these are initiatives and interventions that address the problems that already exist. So when we react to the issue. So for example, when an employee is experiencing back pain, we would refer them to a physiotherapist, or referring an employee to occupational health or an EAP if they're experiencing high levels of stress and burnout. But then if we go to the other end of the spectrum, so the proactive initiatives, and these are initiatives and interventions that aim to prevent problems from occurring in the first place. So they really help to keep the entire workforce well. So if we use these same examples, we can introduce assessments. So for example, workstation assessments to prevent individuals from developing back pain. Or in the case of workplace stress and burnout, it may be about offering regular one-to-ones with employees to check in to catch those issues or problems before they become a real issue. Or it could be around raising awareness, so through general communications, or actually through awareness at the leadership level around stress management, for example. Now, the common question that I get when I talk about proactive and reactive initiatives is, which one do I focus on? And I get why that question comes up, because we use the language proactive, not reactive. But actually, what I've realised and what the research shows is that you need both for a successful wellbeing strategy. So yes, proactive interventions are going to have the biggest impact on the health of your workforce because they reach the greatest number of people, as illustrated here in the top of the triangle. And it creates that environment that will really help employees to thrive and give them that opportunity to stay well. But reactive interventions also have their place. So we don't want to tell you to get rid of your EAP or physiotherapist, because problems will always arise. If the last year has told us everything or anything, we can't stop problems from coming up. But what we can do is make sure that your employees have access to the resources when those issues do come up. So it's more from my side around making sure the access and accessibility and the awareness of these services is there for your employees. Because what I really see, and from my own personal experience, the contact details for the reactive services are under hundreds of emails or in the depths of the intranet. And when an individual is struggling, they're not going to have the energy or the focus to sift through all the information and find what they're looking for. So actually having the visible reactive and the proactive interventions is going to help you create an effective strategy. And this is certainly backed up by the research. This is some data from Deloitte in their recent report from 2020. And it talks about the average return on investment. So looking at it purely in this case from the business case. And what you can see here is that when we only implement reactive initiatives, so those ones that address problems that already exist, the average return on investment is around 3 to 1, so £3 for every £1 spent. But then what we find when we add in those proactive initiatives, so around awareness raising and really helping to shift that culture in your organisation, the return on investment doubles. So 6 to 1, £6 for every £1 spent. And this return is made up in terms of the reduction in absence, in staff turnover, but most importantly in presenteeism. So that's presenteeism is when employees come to work whilst unwell, so they can't perform at their best. And we really find that this is the biggest, that the interventions have the biggest impact on reducing presenteeism. So to summarise, point 1, it's proactive and reactive, not proactive, not reactive. So the second way is probably one of my favourite ways because of the graph. So we have the organisational wide focus. And the way that we've captured this is through the Wellbeing Onion, which I'll go on to explain in a little bit. So recent research from REBA shows that actually 2/3 of organisations already have a wellbeing strategy in place, which is really positive. But actually only half of these focus on the entire organisation. So we've developed the Wellbeing Onion, which is based on a social ecological model. And this really helps to represent how we can reach the entire organisation and make sure that no one is forgotten. So imagine an onion, and I bet you didn't think I would be saying that today, but think of the layers. So here you can see from the diagram that at the core of the onion, we have the individual. We have your employees, the beating heart of your organisation. And at this level, what can we do to address the strategy? So, for example, the question that I'd be asking is, how can we empower the individual? How can we help them take responsibility for their own well-being? What initiatives can you address in your strategy to help them do that? There's lots of different ways that you can do this. We've already spoken about a few in terms of increasing awareness and accessibility to the specialist services. There's also building knowledge through training and including awareness sessions for the whole organisation. And then we go up a layer in the Wellbeing Onion, the mid layer. And this layer is all about those relationships and connections that employees have in the workplace. And this is such a powerful, social proof is so powerful in drawing on those relationships in improving people's well-being. And what we know, what we've all experienced, is that this is the layer that has really challenged that has been really challenged during the pandemic. I noticed a few comments before I started speaking about managing that return to the workplace and how you're able to do that. And actually by introducing or by drawing on the community aspects, reinforcing those relationships will really help to improve people's well-being and make them feel comfortable in a situation that is actually going to be quite anxiety provoking, going back into the unknown and the unfamiliar. So the question that I would ask myself is, how can we really draw on these relationships to improve employees' well-being? I've seen it done in lots of different ways. Organisations that I work with have peer-to-peer support. They have buddy systems, different group challenges. If you've got a particular workforce that loves a good challenge and a good competition, employee forums. I've also just worked with a client who mentioned digital co-working spaces, which I think is an absolute fantastic idea. And it's a way that you can bring people together, even if they are still working at home. And then the final layer, we have the organisational layer, encompassing the individual and the relationships as well. And here at this layer, I would be asking myself, how can our cultural organisation, our environment, the policies and procedures influence change from the very top? And the strategy is certainly one way of doing that, to bring everything all together. So I hope you can see from this Wellbeing Onion that if you only focus on one layer, so if you only focus on the organisation, top-down approaches, then you'll be missing the other layers. So to make sure that you develop the most effective strategy, consider top-down, bottom-up, and from side to side using the Wellbeing Onion. Okay, so the third way to supercharge your wellbeing strategy And this is around generating and driving engagement based on those evidence-based principles. Now, engagement is one of those things that organisations come to me with, and the questions are, well, how can I engage those people? You know, we've got these initiatives, but actually they won't have an impact if people don't engage. And the simplest way that we can approach this is by using evidence-based models. And the easiest one in the world to implement is the EAST model, which I'll just run through very quickly now. So the EAST model encourages us to make initiatives easy, attractive, social and timely, which will ensure the greatest level of result. So an engagement. So if we start with easy, now, pardon the pun, but actually this is the easiest step to get right. It's about ease of engagement, and that will really help to increase your engagement from your employees. So simple ways of doing this, just simplifying the communications, making things one click away rather than 4 or 5 clicks, because every click you slow someone down. And then also you could provide multiple opportunities for someone to get involved, just make it that little bit easier to access. In terms of attractiveness, so making the initiative or the intervention appealing and rewarding to employees. As an employee, when I see a workplace health initiative on the horizon, my first thought would probably be, oh, what's in it for me? And if you can make those benefits really clear and really show that actually the employee is going to get a lot out of this initiative, then they're going to be more likely to engage. So make it clear. Is it about improving their well-being, saving time, saving money? There's lots of ways that you can go about it. And then the other part of attractiveness, which is also important to mention, is that, does it look pretty? And I know that that might sound shallow, but actually we engage with things when they're nice to look at, when they're easy to use, when it's not clunky. So consider that in any initiative you implement. So whether that is an online platform or even just a handbook with lots of text, that's obviously sometimes quite a big turn off. So make it look interesting, make it look pretty, and your employees will be more likely to engage. And then there's a social aspect. I mentioned earlier that actually social initiatives can really see the greatest amount of impact. And this is all about FOMO. So for those of you who don't know, that's the fear of missing out. Because it's in our human nature when we see someone else doing something that we want to do it too. So really harnessing that social proof and making use of that will help to spread the word, get employees to shout about the initiative that you're introducing, and that will help with engagement too. And the social aspect is all about bringing that community together as well, because that mutual social support can really help with the maintenance of the engagement. A lot of what I've spoken about in this point is the initial engagement, and of course that's important, but it's also the maintenance and the sustainability as well. So creating that social aspect can really help people to support each other and continue in whatever initiative it is. And then finally, it's time. I don't need to tell you that we are all short of time. So think about that when you're implementing initiatives. An example that I like to use is that actually a 15-minute awareness raising session is perhaps better than a 60-minute awareness raising session that's never attended. Could you block out time in your employee's diary to set that side of time? Or is it being flexible in terms of when they can engage to give them multiple opportunities? So to remember to drive and to generate engagement, use evidence-based principles like the EAST model to increase that engagement with your initiatives. Now, the fourth way to supercharge your strategy brings us back to the data that I was mentioning. So this is the wants versus the needs. And this is so important because if we really know and we really understand what your workforce will benefit from, then that's when your strategy is going to have the biggest impact. It will be more meaningful, and then actually your employees will be more likely to engage because it's what they actually want and what they need. It's important to recognise, though, on this point in particular, that sometimes these wants and these needs can differ. So to give you a very clear example, our data that we've been collecting over the last few years shows that actually exercise is the number one priority for employees when they're thinking about what they want to work on or what they want to focus on in terms of improving their health. But actually, what the very same data shows is that the majority of them are actually doing really well in physical activity. It's the best area of well-being across the board. And that actually areas such as sleep and mental health are the ones that possibly need to focus on. And that's why looking at the data is so incredibly important, because otherwise you may be missing out on those key areas that could result in the biggest boost to productivity at work. It might mean that you end up misallocating resources, or perhaps you're wasting time, or maybe that's the reason why engagement for certain things are so low. And it means that overall, your strategy will be less effective. So in terms of how to collect the data, well, there's lots of different ways of doing this. Going back to what we were saying with the triangle before, the proactive and reactive triangle, that actually assessments are really beneficial in collecting that data, because then you're hearing from all of your workforce, not just a select few. It might also be pulse surveys. It might also be employee forums, which are really beneficial to open up the discussion a bit more, gives you a bit more flexibility. But what we would say, in however you choose to gather this data, is that it should be approached with care and with sensitivity, because this is information that people or employees might not want to share with you as readily, or haven't had time to reflect on them themselves. So actually, we'd recommend collecting the data anonymously and with it being overseen by a wellbeing professional, if at all possible. So to summarise point 4, we have employees' wants and needs to consider, and also thinking about how they might differ. So finally, this brings me to the 5th way to supercharge your wellbeing strategy, and that is to consider all areas of wellbeing. Now, from my experience over the last year in Champion Health, and according to the research as well, there is a large impact, an emphasis on mental health in the wellbeing strategies. And that's also reflected in the most recent REBA report, which showed that 94% of organisations that have a strategy include mental health. And given my background in mental health support, that actually this is music to my ears. We have made incredible strides in talking about mental health in the workplace. And it's great that it's there. But I can't quite believe I'm saying this, but actually, as well as having mental health, we also have physical health and financial health and emotional health and social health. The list is endless. And actually, we're probably doing our employees a disservice by only focusing on one aspect of their well-being. So it's important to expand your wellbeing strategy if it only focuses on mental health, to cover those different areas: sleep, physical health, physical activity and exercise, financial wellbeing. Obviously, those concerns over financial security over the last year have definitely increased following the pandemic. So being able to target all of these areas will have the biggest impact on your employees' well-being. And being holistic, it will also help to create a more progressive strategy. So you can start talking about the issues that are kind of largely ignored at the moment. So issues around women's health and the menopause in the workplace, neurodiversity, these are all issues that impact our well-being and so should be considered as part of our well-being strategy. So to summarise my final point, all of our areas of health are connected, and so your strategy should reflect that. Now, just before I finish, I wanted to end on an example of best practice, which I think really serves to show how powerful and impactful having a strategy that touches upon all of these initiatives and aspects can be. So this was a study by McDade et al. In 2012. So I think probably a little bit before their time, actually, very forward thinking. And their strategy included much of what I've discussed today. So that health and wellbeing strategy, screening, we have personal health advice and tailored health support, and then general awareness raising as well, along with seminars and workshops. And the results are really quite staggering. So compared to a control group, you can see here that there's a significant reduction in stress, reduced absenteeism and presenteeism, as I was talking about earlier. So a definite increase in productivity. And all of this led to a kind of unbelievable return on investment of 9 to 1. So that's £9 for every £1 spent. I know it's not just about the business case, but it's important as well to think of all the impacts that these initiatives can have. And it can clearly have a very positive effect on your employees' well-being and your organisation and your business as a whole. So to recap the 5 ways to supercharge your strategy, we have proactive and reactive initiatives. We have an organisational wide focus using the Wellbeing Onion as your guide. We have the idea of generating and driving that engagement through those evidence-based models such as the EAST model. It's about understanding employees' wants and understanding their needs using data, and also understanding that they might be different. And then finally, it's about considering all aspects of well-being, not just mental health. Oh, perfect. That's brought me to the end. Thank you so much for listening. As I mentioned right at the beginning, and also Harry did as well, that there's a lot of information. The recording will be available, so you'll be able to go through it in a bit more detail. And if you have any questions, please just pop them in the chat function, and Harry and I will get to them during the Q&A section. It would also be wonderful to connect on LinkedIn to open the conversation around workplace wellbeing, because I love it. So thank you. It's been an absolute pleasure, and I will pass you back over to Harry to show the platform that we've been working on.
Thank you so much, Laura. I could just listen to you all day. Honestly, it is excellent. The work that you're doing with all of our members, our community as well, and putting on sessions like this. So a big thank you from me. Happy work anniversary, is that the right term? Happy
I think so.
We'll make sure that we'll catch up at some point when we can, with a glass of red wine or something.
Can't wait.
As a well-being. But thank you so much. So there's been some amazing messages. We're going to cover those shortly. Just before we do, I want to ask this question of what do these companies have in common? So Spotify, Apple, and Netflix. What we found is that they all cover all areas of their respective areas. So Spotify, if I want to listen to some cheesy Taylor Swift or some ABBA, for example, if I want to listen to a podcast, it's got all of my audio needs in one place. It's attractive, it's easy, it's timely, all of the things that Laura was talking about. Apple with the iPhone, that's the same concept of bringing everything into one device. And you look at Netflix, it's exactly the same, but with TV, documentaries, all sorts of channels within. This is what we're looking to do at Champion Health, is to build the Netflix of wellbeing going forwards, to make healthier easier for everyone, Because at the moment, being healthy is confusing. You've got mindfulness apps somewhere, you've got female health tracking apps elsewhere, you've got exercise platforms, you may be paying for a gym membership, you might have a nutrition app. I could keep going on and on and on within here. And what we're wanting to do is bring it together to make healthier easier for everyone. So our platform, it's one platform, it covers all areas of well-being, and I'll be sharing that with you shortly in terms of the areas that we cover. We want to take the headache away from you of having to look at absolutely everything. And what we can do is customize it to you and your workforce. So if you're working in manufacturing, for example, we can customize it to them. If you're in the financial sector, we can customize it to employees. So all of the comms are met with the employees' needs. So within here, you've got all of your wellbeing action plans. You've got the hub, which has your workouts, your nutrition plans, sleep stories. We've even got sleep stories for children within here to support the parents with their sleep. We have the Academy, which is all of your learning and development content built by Olympians, best-selling authors, health experts within their respective areas. And these are all audio and video led. You've then got tracks, so you can track your mood, your menstrual cycles if you're female. So we're breaking the stigma down in all of the taboo areas at the moment to make healthier, easier for everyone. Not only this, we are also able to generate through anonymized and confidential analytics health trends within your workforce, and then we can assist you in building the health and well-being strategy that's customized again to your workforce going forwards. Many people ask me, why is no one else doing this? We don't know, quite simply. This is what organizations need to be doing from the research, but also from experience with our members as well. So in terms of the topics that are covered, we truly do cover all areas of health and well-being, whether it's financial well-being and looking at relationship with money, whether it's mental well-being and resilience and stress, whether that's social well-being, as Laura touched upon. We cover all aspects within one platform, and it's personalized to every single individual going forwards as well, which is absolutely essential. So if you would like to go through this with me, please don't hesitate to get in contact with harry.bliss at championhealth.co.uk. Last night, our new website went live as well. So please give Champion Health a quick Google and let me know your thoughts. I'd be really keen on hearing your thoughts on that. But now onto the Q&A. So over to what you've been asking going forwards. So I think we've got quite a few questions already, Laura. So let me just scroll up to the top.
I've just been trying to go through them all.
We're going to try and get through as many as possible. If we don't get through them, then we will follow up with you as well, because there's been loads of engagement. So thank you on that. The first question, Laura, is from Kay. So I have such a huge audience at work, factory operators, exec managers. How do I deliver when they want such different things from well-being?
Yes, that is a tricky one, isn't it? And I think it's a very valid point, because I also saw something similar around the traditional workplace initiatives like mindfulness or meditation won't fit for everyone. And I think that's such an important thing to reflect on, is that actually you will have different audiences within your organization, let alone organizations being completely different to each other. So where I would start in terms of strategy development for a company like this is understanding the different types of employees and actually what they really do want. Because from there, we can then work out how we can tailor the different aspects of well-being to that particular team. So it may be that actually exercise-focused initiatives might be quite useful and a good way to engage people in something that perhaps they might already be doing, whereas other ideas might go for another section of the team. And it's really understanding how it differs and then following up off the back of that. But it is very tricky, and actually we might not get it right first time. That's something that I also explore with clients, and that's where the evaluation of the strategy and that feedback really contributes, because then we can actually understand what is working and what isn't working, and adapt from there. And that definitely kind of feeds into that responsive framework that we spoke about right at the beginning, rather than just your stagnant document.
Yeah, and I think to just add to that as well is we hear that from everyone,
Mm.
in that certain departments are male dominated, certain departments are female dominated, they require certain different types of needs. The key thing for us, and this is why we built this platform, is for people like you to be able to personalize that journey to individuals, to be able to understand what people are wanting and what people are needing as well. And then actually suggesting those interventions all in one platform going forward. So as you say, mindfulness meditation might be something they have absolutely no interest in. So therefore, we'd want to suggest different initiatives that they can then engage with. So personalization within any wellbeing program and any wellbeing platform is absolutely essential. And that's one of the things that we do work extremely hard on. Laura, you mentioned, and this is one of the first times I've heard of it as well, so I'm fascinated about how you're going to answer this. But in terms of digital co-working spaces,
Yeah.
who's asked about that?
Yeah.
How do they work?
I feel like I've bigged it up a little bit. It's a really simple idea, and honestly, it's something that anyone can do. It's essentially just setting up as an open Zoom call, for example, or an open Teams call for anyone to join. And then you can get on with your work. If it's someone who's from the same team as you, perhaps there's those odd little questions that might come up, and then actually, because you're already on the call in this digital working space, you can just drop a question and ask it. I mean, I know from my personal experience, I feel really bad when I'm pestering lots of people with questions all the time. So, and that's where I really miss that office working environment, because we don't really get that when we're sat between our own four walls. So actually creating a space where people can come together. It might not work for everyone. Some people prefer having silence or listening to their own music, whatever helps them work productively. But it's about giving people a choice and giving people options. I think that also taps into the previous question as well, is that when we give people choice, then they can choose when to engage and what to engage with, and then we'll increase engagement off the back of that. And so it's just about opening up different options, really.
And trying it. And as you say, I think there is an element of trial and error. We shouldn't expect everything to work all of a sudden. There'll be certain things that will surprise you. And we've actually had a manufacturing organization be surprised at how many people did uptake mindfulness. And so certain things may surprise you, certain things may not work, and so on. So I think that's essential for trialing out something like that.
Yeah, and actually, sorry, Kelly has just put a comment saying that in Teams they've set up a Teams channel called Online Breakout Zone to try and increase the non-work social engagement. I think this is so important. I don't know about you, Harry, but whenever we're on a call, I always feel really bad about mentioning something non-work because you feel like, okay, I'm on a call, I'm switched on, it has to be work related. But if we translate that to the office, we're not on 100% of the time, are we? Yeah. So actually increasing those channels of conversation, of communication, going back to the social aspect from the East model, that's going to have a real impact and help to develop that interpersonal layer of the wellbeing onion.
Yeah, perfect. Perfect. I love the wellbeing onion.
So do I.
In terms of, Kelly's asked a question in terms of, would you consider partnering with Vitality? We have private healthcare plans with work and currently access benefits such as mindfulness apps as part of that. So Vitality is one provider that you can go with. In terms of Champion Health, our focus is to bring everything into one platform for all of your proactive health and wellbeing needs. So if you would like a conversation about that, then please reach out to me following. But Vitality are a great provider within the private healthcare space, without a doubt. So Dan's asked a question. This may be the last question that we can get to for today. Is East model is great, so thank you for that feedback. We use it regularly. That's what the likes of Uber, Instagram, all of the Silicon Valley startups, or not startups as such now, but they use to generate engagement and drive engagement. But thinking prior to this point, how do you support a business to know their employees better before the strategy is put in place?
Yeah, it's such an important part. Certainly ties to the data aspect, but also a wider issue, which actually I was going to mention, so I'm glad that I've got the opportunity to. It's all about understanding your organisation and your values. And actually, when a strategy aligns with that kind of language that you use, when it connects with the values that you already have and that you've demonstrated in the past, the strategy will be have a greater impact and be more effective. I think for me, talking to employees, walking the floor. Strategies aren't something that is purely top down, as we've already explored today. So actually having conversations with employees, bringing them into the strategy development, perhaps creating a strategy team that will really help to shape the direction of your strategy. Because what I see is that leaders often have one idea of how things are going and one idea of the issues, but then actually when they talk to the employees, something completely different comes up and you'll have missed what that was, and you wouldn't have been able to address it in your strategy. So it's all about exploring what really matters to your employees, but also tying that into the language and the approaches you already use in your organisation to really help shift that wider cultural kind of viewpoint on well-being in your company.
Fantastic, thank you, Laura. And there are some other questions, but I'll get back to them by the close of play today. So that wraps it up perfectly. So a big thank you to yourself, Laura, for taking out the time and sharing your secret sauce in terms of what we can do to be able to deliver and develop robust health and wellbeing strategies.
Yeah.
Going forwards, what's next? So we're wanting to run these live sessions to help individuals and organisations like yours. So we'd love to hear back your feedback, your insights as to what you'd like to see going forwards. We'll also send across the live session to you, so you can go through it again. As I know, it is action-packed. And then if you would like to get in touch to hear more about Champion and how we can support people, the people that power your organisation, then please don't hesitate to get in touch with us going forwards. Our mission is to make healthier easier for everyone going forward. We want to make well-being inclusive, accessible and engaging. The way that we're looking to do this is to bring it all together into one platform. So thank you very much for joining this live session. We look forward to seeing you in the future and hearing your feedback as well.
Yes. Thank you.